The guideline recommends if you have fever and pain, you can take acetaminophen, which is Tylenol. The Advils and the NSAIDs, there may be some issues with it, so the recommendation is just Tylenol or acetaminophen. So why does getting a vaccine that is supposed to prevent infection make you feel ill at the time of the administration? Simply because when you are giving a vaccine, the body recognizes a foreign substance. The body begins to mount an attack against it, and during that mounting, all the chemicals of inflammation are released. So you feel inflamed, you feel like you have the flu, simply because it's your immune system revving up to fight the foreign antigen, the foreign protein that's or mRNA that's given to you. What are the long-term, if any, side effects of the vaccine? We don't know. It's so new. We hope that nothing long-lasting and severe occurs, but you balance risks and benefits. And the virus, COVID-19, has already killed 500,000 people in the United States and even more throughout the world. So it's a balance. Do you wait to get the perfect vaccine, or do you basically block the pandemic from spreading by getting herd immunity up faster? If you look at the influenza in the 1918, historically, it kept going. It wasn't until the whole world developed herd immunity that's when the pandemic stopped. At that time, there was no treatment, no diagnosis, no vaccines. So it took a long time for the pandemic to end. Here, we have an opportunity to end it earlier due to the vaccines that are produced. So the question is, can we stop hand washing, the social distancing, the masking? We know that the best vaccine that we have now only covers 95%. There's still 5% risk that you still can get infection. And the studies so far also show that even if you've got the vaccine and you get the COVID infection, you may not feel the symptoms, but you are shedding virus. So you're also at risk for spreading to others. So for now, the recommendation from the CDC is to continue the same hand washing, don't touch your face, social distancing, ventilate, be open and outside. So the question is, are we expecting another COVID-19 epidemic down the road in September or in the fall? We don't know. We hope not. Based on the current vaccination rate of 1.5 million doses per day, the CDC is predicting that by September, all of us will, it'll be 70% of the country will have herd immunity. So by September is when we should basically wipe the pandemic out. However, if in September a new strain occurs, then we have to prepare to get another vaccine to counter the new strain. As you know, with influenza, every year there's a new strain, so we have to have a new batch of vaccines. It might be that coronavirus will require the same thing of us, that we have to have a new vaccine every year, or every 6 months for that matter. For the moment, we are hopeful that the new vaccine will bring all of us to herd immunity and basically wipe out the pandemic. In the meantime, please be patient with when you can get the vaccine. By September, we should all be able to get everyone vaccinated and beat the pandemic.